Hi, my name's Prashant. I'm going to talk about Margaret, who's been a long-term patient of mine, been one of my most amazing patients, I've got to say. The treatment that we provided has been involved, and I'm going to talk about that. Right, so Margaret came to me some 2.5 years ago, and she came in with problems that are joint-related, something that we typically see though quite a lot of, being a prosthodontic practice. Her issues were also compounded by severe grinding or damage to teeth, aesthetic concerns, and jaw problems. So the whole set of issues, we discussed 3 quite distinct options for her. None of them were easy, but thankfully we had a good, honest discussion, and she was able to decide quite rationally as to what she wanted. I think that's a key to it. The patients really have to take it on board, what we're saying, and they need to actually, I suppose they need to have trust that, hey, I can put aside that bit and, really listen to this options. So we went through all the 3 options, and she decided on X, which was to rebuild her teeth. But in doing that, the whole process doesn't just happen overnight. You have to carefully then build the bite up, repair the damaged teeth, making sure that the joint actually recovers, doesn't get worse. That's done in a provisional sort of temporary phase so that we're not overcommitting. We need to fix the joint problems and get it out of symptoms before committing to a whole bunch of crowns and expensive work and going, oh crap, that didn't work. So there was a bit of a provisional phase where she showed good improvement. The joints became better. So we felt safe to go one step further, which then entailed another more detailed provisional phase before we really committed to quite extensive restorative work, which is putting crowns on all her teeth. Now that fulfilled joint stability, which we had tackled anyway. That also fulfilled her desire to have aesthetic smile, and my need to provide her with a strong long-term treatment solution so that she doesn't keep damaging her teeth and then coming back 10 years later with no teeth in her mouth. All in all, it's all worked out great. It's taken some time, which is quite typical though. It doesn't happen overnight. No desire to rush anything, and it's worked out really well. We've got a great rapport, and at the end of the day, that's what it's about.
Well, I went to Emma Bond because, she's my just my dentist that I go to. I had an enormous amount of pain in my jaw. I was very bad with grinding my teeth, but the problem became such that I couldn't open my jaw very wide without it cracking and without being in a lot of pain. And I knew that I really had to do something about it. Yeah, before it got worse.
That problem was going on for some time though, wasn't it?
It was.
Worse over time.
It was, and I actually put it off for quite some time. And I would have put it off. No, I wouldn't have put it off. I should have come earlier, actually. Yeah.
I'm going to say it's quite normal though.
Yeah.
Yeah. I think a lot of people do put it off.
Yep.
Yes.
I think it's just that fear of how, what is exactly going to happen, what the problem is. Yeah.
I've had patients that have put it off for like 10, 15 years.
But I think it just got to that point where I really didn't want to leave it that long though, because it was really becoming quite excruciating.
Yeah.
So so Emma referred you, and that's when the process started. So
do you? I know it's been a while. Like 2.5 years journey.
It has been a while.
Yeah.
Yes.
Do you remember the starting bit?
I do. It was it was a bit bewildering, I suppose, at the time, because once again, you don't know really, as much as you explained it to me, actually going through the process is a bit different as well, because of the problems that we faced along the way. But it was, you were very detailed in your explanation, in your explanation. So I do remember it.
Yeah.
Remember it well.
Yeah.
Remember Patricia?
She's still there.
She's still there.
Now, what intrigues me, I gotta admit, is what gets a patient to commit and you know your commitment was huge.
My commitment, I suppose, was huge. I really believe that good teeth, good hygiene, those sort of things are very important to me. And a nice smile. A lot of it was for the aesthetics as well, not just because of the problem that I had. I'm very big on children and grandchildren going to dentists on a regular basis, and I did. I wanted not so much my youth smile back again, but I did want to have something that was aesthetically pleasing, and so I suppose that's what really made me commit to it. That when you were explaining what could be done, there were 3 different courses of action, which I'm sure that you will talk about later, but the last one that you suggested was the one for me. Yeah. So longer, but worthwhile.
Yeah. Quite a costly affair.
It was, but once again you explained that to me, and I think you came in shorter than what you actually quoted, so
that's a shame.
that was pretty good. Yeah, you should have. I'm only letting you know now.
Lucky you gave me the wine.
Well deserved.
That's right.
But thank you for all the Valium you gave me too along the way. I'm allowed to put that in.
No, I'm going to say it's been a hoot. It's been fun fun times.
Yeah.
So Margaret, when you came in and when you were referred in, what expectations did you have?
Just that the problem would be solved, obviously. My expectations were probably that would be the resolution would have been earlier. But
2 months earlier.
2 months, have 2 months. No, but the expectations were that I would be pain-free, and that my teeth would be as such that would suit my age and my face. That it wasn't going to be looking like false teeth and things like that. So the expectations were pretty high from me, and you've met all of them, and I'm absolutely thrilled with the outcome. I just couldn't be happier. So
that's great.
Yeah. So
now, would you, there are patients that have similar problems here, and they come in and they sort of torn between what to do.
Sure.
It's hard to get rapport with everybody every time. That's just human nature. What is one thing you would say that would help them in deciding?
Just to relax and really listen to what you have to say, not to just to go off. I think sometimes the information that you give it initially can be a bit overwhelming, and they need to go away and come have a think about it, come back and probably just have more of an in-depth talk if they were feeling uncomfortable about it. I think just that, pretty much that, but just to really listen and to listen to you and to what the outcome could be, whether it is possible that you can help in whatever situation, which I'm pretty sure that you'd be able to in most situations, but just to really listen to you and what you have to say and the outcome.
Yeah.